again?
So this one's recording.
Okay.
Let me
So we were on the metformin part.
And that's the one that can cause the lactic acidosis, the 48-hour window with iodine. The only 4 other meds that she had mentioned besides the insulins was the 2nd generation sulfonylureas, the biguanides, which is metformin, the DPP-4 inhibitors, she mentioned Januvia. And then for GLP-1, she said the newer one is the Trulicity. But the DPP-4 inhibitors and I think it's GLP or GLD. I think it's GLP. Those are given once a day.
Yeah.
Those 2. And then after I have.
And those are the DPP-4 inhibitors?
Yes.
Are we still on diabetes, guys?
Yes.
Yeah.
Okay.
And then I had long-term complications, and she had a question regarding one of these on one of the tests. So the microvascular is like the neuropathy, the nephropathy, and then the retinopathy. And those are the ones that we need to do the teachings for foot care for the neuropathy, and then the eye care for the people with diabetes. So the eye teaching or the eye checkups, and then the foot care. And she mentioned foot care, so we need to make sure we know about the foot care. And the macrovascular is the cardiac and then the cerebral effects. So the microvascular is the neuropathy stuff. The macro is the big ones like cardiac, and the cerebral, the brain.
And that's with type 2 and type 1?
I want to say yes.
Okay.
So it's like a long-term complications.
Yeah, long-term complications, and then she has it broken down into microvascular and then macrovascular.
Okay.
And she has for treatment for just diabetes in general, of course, is the sick day management. You need to tell them they need to exercise, watch their diet, the medicines that you're giving them for their diabetes and what that entails, and then just how to prevent the long-term complications like the neuropathy, the foot care, and then the retinopathy, the eye care.
Yeah.
You can peek in and way better.
And I think on the quiz, it states that albumin in the urine is one indicator of clinical nephropathy.
Yes.
So, yeah.
Albumin.
So that was like where she talked about like stressing to them about having like routine lab work done.
Yeah.
For like monitoring for the bun and the creatinine and the albumin.
Yeah. Is there anything else you guys want to touch on for diabetes? Because I have thyroid notes after diabetes.
Let me see.
And corticosteroids is one medication that elevates glucose.
So I know for the treatment plan for DKA is IV fluids, but what's the priority for HHS?
It's basically the same.
Basically the same, but there's no acidosis to treat.
Yep.
Same. There's no acidosis.
Yeah.
So the DKA has the insulin IV. You're doing the rehydration of normal saline. You're monitoring and replacing the electrolytes. And then on top of that, you're reversing their metabolic acidosis. And then for HHS,
strict INO.
Yep, and strict INO. I keep forgetting that one. Thank you. I'm writing it down right now.
For HHS, is strict INO?
Yes, for both of them.
For both. Yeah.
So the only difference is the reversing the metabolic acidosis, and that's only for diabetic ketoacidosis. But other than that, they're the same.
I did have that in my notes.
For the DKA, with the treatment, you have to monitor the potassium mainly.
For
Yeah,
both of them.
you might need a potassium replacement.
I thought that was for both of them.
Hopefully there's a question like that. God.
It is for both.
Yeah.
I can't even get a 75% on 50 questions. What does that think I'm gonna- This all- you can miss 11 on a 100-question test. Sure.
We'll all do great. It's gonna be okay.
Yeah.
And so for the DKA is children and adolescents. And for the HHS is 40 and older.
Right. Because what I have here is type 2, you're at risk for DKA, correct? Or no, HHS,
No, it's
excuse
just.
me.
Mhm.
Yeah, and then DKA is type 1.
Mhm.
Sorry, I missed my own note.
And then just know that the insulin is the hormone that helps regulate the amount of glucose in the blood. The glucagon is the hormone in the liver that turns glycogen into glucose. And then the
Mhm.
pancreas produces the insulin and the glucagon.
And
And
I
the
think
liver is really sensitive to insulin.
Insulin levels. So it
And I
turns
think that
glycogen into insulin.
Yep.
they had a
I'm
question.
not gonna remember that.
A question
Yes, you will.
I believe, and it was asking about the fluids that were supposed to be given, and it might have been like a select all that apply or something. But for the DKA treatment, it's supposed to be the 0.9% normal saline
Yeah.
and the 0.45 normal saline. Infusion 200 to 500 milliliters or whatever, in dextrose 5%. I think I might have missed that one, but I did have the fluids down. I can put that in the chat if we need to.
Okay.
I might have missed that one.
I only know about the normal saline. Which other one you said?
The normal saline was the 0.9 normal saline and the 0.5
0.45.
normal
Yeah.
saline. Yes. And the dextrose 5%.
Okay.
You guys good with diabetes? I figured we could do this again tomorrow if you guys are down too.
Yeah, I really need
Yeah,
to go over
that would
perfusion.
be fine. I mean,
The first 2 exams, like, I know it doesn't sound terrible, but I got 70 and 72 on them. So I felt like, okay, I'm a little bit good, but these last 2 exams killed me.
Yeah.
Killed me.
Yeah, they were
So,
Yeah, the perfusion oxygenation, I don't know where I went wrong, but apparently I did. So
I love
I
it.
felt good, and then I was like, that's not good. Okay.
Yeah. Well, because I did everything I could. I did the quadrants and I did the crossword puzzle. I did the 6 questions on Canvas. Not one of those were on the exam.
Yeah.
I never put those
Tell
on
me
there.
And
about
even
it.
Jennifer messaged Miss Barrero and she's like, hey, where's all this extra stuff you're gonna give us? And she's like, the crossword puzzle.
Yeah.
And the exam.
Didn't
The
she
practice
practice
quiz.
that?
No, so I did the crossword puzzle and then I posted it to Quizlet. So everybody has, like, if you're a member, well, you can look at it. I don't care who's a member, look at it. And not one question from the crossword puzzle or the 6 questions from Canvas or on the quiz.
Are we doing thyroid next?
Yeah.
Yeah, let's go for thyroid.
Let's go. Yeah, how do I exit out of this thing?
It said right when they started the thyroid video, Miss Marrero said that the thyroid gland is at high risk for bleeding.
Mhm.
The normal thyroid function needs the T4, which is the thyroxine, the T3, which is the triiodothyronine, and then calcitonin and iodine. So one of the most important ones for thyroid is iodine. That's
Yes, yeah, because I remember
Right.
in the Q&A, I asked her, I was like, is calcium going to be the main one? And she's like, well, iodine too. So I wrote that down because.
okay, Kels. Okay. The thyroid hormone, that's made of a combination of the T3 and the T4, and both of those are synthesized and stored in the thyroid gland. I don't think we need to know the anatomy part.
No.
I don't think we need to know the binding hormones for that stuff either. Just know that TSH controls the release of T3 and T4. And it's
Is that-
regulated by the negative feedback system.
Right.
We need to know the
In the
lab.
hypothyroidism, the TSH is high.
For what?
In the hypothyroidism, so the TSH is high.
Yes, because it's opposite.
T4 and T3, they will not elevate.
Yeah, I have that somewhere.
And in the hyper, the TSH is low. But then the T4 and the T3 will elevate.
Yes. Yeah, because it's the negative system, like I just
It's kind of hard if you just have to maybe memorize it. Because
Yes.
if you try to understand it, then you're like, okay, what am I reading?
Well, so the way that I try to understand it is like T3, T4 aren't doing anything hypo, low, and slow. So TSH kind of has to pick up their slack, and that's why it's working harder.
Yeah.
It's
No,
higher.
I'm just saying in general, like now
Yeah.
you're trying to go through it, you might as well just memorize it. Don't try to figure out why.
Why
I'm
it
saying.
doesn't.
Andrew,
Yeah.
I don't know if we need to know the lab values. I don't
I
think we do
them.
because she said, I don't know if she said in our meeting after clinical or something. I just remember her saying to not focus so much on the lab values. But
Well, but she did have a question on the exam that I think one of them were out of range. So then you had to know.
you think
what was it, like, if it
TSH
was-
is probably the main one to know then?
See, I don't know. I would say it would be the T4 and T3 because like TSH wasn't really like on that exam. It just said high, and I remember seeing levels of the T3 and T4. I could definitely pull those up on Lipmancock. I have them written down right here. But I mean, I stored them to memory. I just wanted to see if everybody else did, if I just
I
wasted
think
time.
she emailed the correct numbers to us, right? Because I think Lippincott was off, right?
Was it
Might
on?
have.
Didn't
If
she
I have
send them
Lipmancock.
to us? Like through email before, Miss Marrero? She sent the
Yeah.
actual.
She
Did you
did,
guys-
but that was because of the little thing that was in the book. The little video and the
Mhm.
chapter
Yeah.
was wrong. So
Okay,
she
that's
sent
what
it
it
back
was.
to
Is
us.
the
Yeah.
TSH is
So-
0.45 to
Yep.
4.5. Is that the same
Yes.
thing that you have?
I
And
do.
then T3 is 80
Put in
to
the chat, Andrew.
200. Is that the same thing you have?
Yes.
Is
And
it
the
able-
T4 is 5.4 to 11.5.
Okay, where's the, oh,
That's a lot.
it won't seem right to me.
You said TSH was 0.45 to what?
4.5.
4.5. That's what I have. I don't know if everyone else have that.
I do too.
Yeah.
Is there, obviously I don't know what I'm doing. Hang on a second.
But I think that the TSH is important because that's what confirms if you have like a diagnosis, right? The TSH.
If it's hyper or hypo, maybe.
Yeah.
Yeah.
So I
we'll
think that
just
they're
go ahead
probably
and
going to ask that, like if a TSH level is like really high, then
show
they're gonna
us the
say, okay,
levels and be
hypo.
like which one's abnormal or something. So
Yeah.
we'll just go
But you
ahead and
know, it's like the
memorize it.
opposite, it's reversed. So if it's high, then they're gonna have a low
Mhm.
hypothyroid.
Okay, so
Okay.
what were the levels for today's, can somebody say those levels again? I'm sorry. I just had to get a colored pencil.
I got
What
you.
were you saying?
He's sending
Andrew
us-
sent it.
He's putting
Oh, thank you, Andrew. Got
Andrew
it.
sent it in the chat.
Thank you.
I got you. And I'm gonna do the T4 also.
Yes, thank you, Andrew.
So definitely we should store all these to memory just to be safe.
Probably.
Yeah.
We'll need them eventually, I'm sure.
Yeah,
I
right.
would, just for this exam here too.
So
Did
the
you-
purpose of the thyroid is to control metabolic activity.
Yes, ma'am.
It's necessary for normal growth. So I think, I don't know if you know, Alethea, if you have hypothyroidism or if you have one of those and you're on like a hypothyroid medication, doesn't that stunt your growth? I feel like I read or watched something about stunting their growth for kids, for pediatric thyroid. Yep. So if you have congenital hypothyroidism, which is also known as cretinism, which means you have a low T3 and T4, then
I'm not sure. It says it stunts their growth.
yeah,
Oh.
Yep.
they could have short stature, growth failure, and delayed physical maturation.
Yep.
And then they gave us a question about this, and I chose to put it in a bottle because she said in the video to have them crush up the pill for the kids and put it
Oh
in.
yeah. I remember that one.
You don't put it in a bottle, you have them put it in a dropper. I
You
don't know
can
if that's gonna be on there,
you
but
can put it in the nipple of the
yes.
bottle. Not in
Yeah.
the actual bottle itself, but you put it in the nipple.
I just know I chose something for one of those questions on the test and I had clicked put it in the bottle and it was wrong. So it was supposed to be put it in the dropper for a child or a baby.
Wasn't it like if you did
Oh,
put it in
you're
the bottle,
talking about the.
No, go ahead.
No, I was asking her about the pediatric what's it called?
Cretinism. Mhm.
Cretinism congenital. That's what you're talking about.
Yeah.
Oh, okay.
Congenital hypothyroid. And they said to beware for children of the poor sucking response and then the large tongue.
And cool extremities, short limbs, muscle weakness, hypoactive, not crying.
Yeah.
That's what I have.
Mhm. Yeah, I have the T4 is high in hyperthyroidism and it's low in hypothyroidism. And the labs they usually draw to diagnose thyroidism or hypo or hyper, I have is TSH and free T4. And like for the signs and symptoms, she showed that video or on the video, like a little guy for hypothyroidism and then the little guy for hyper. And for hypo, he had the hair loss, he was lethargic, he was like shivering, intolerance to cold. I got these mixed up on the test.
Me too. And she's like, "Oh, you need to know the signs."
It didn't make sense now
Okay.
that I just
So
think
you
about
guys
it.
are confusing.
Yeah. So the hypo is they're cold, they're tired, they got muscle aches, like they're real sick, little hypothyroidism person.
Low metabolism.
A thick tongue, it said too, is hypo with
The
constipation.
hyper is so they have the bulge eyes. I think it's called exophthalmos or something like that.
Yeah.
It's in the book, yeah. And they have the enlarged thyroid, localized edema. They're always swollen.
The clubbing of the fingers,
Yes.
intolerance to heat,
Mm-hmm.
the flush.
I always remember, what's her name? Wendy Williams. That's what she has.
I don't know who that is. Williams?
Wendy Williams.
Oh,
I don't know what happened. It just like kicked me out.
I didn't do it. But yeah, the hyperthyroidism is everything that you said. And then it has like, so hyperthyroidism, diarrhea, hypothyroidism, constipation.
Constipation. Mm-hmm.
Hyperthyroidism,
Okay, so
systolic blood pressure.
I know you guys probably already got past this, but I had just got kicked off at that time. But you were saying to not crush it up and put it in a bottle because I had on there, like on my notes, to where you could add it to the breast milk or the formula. But is that basically putting it in a Doppler and giving it to the child instead of giving it through the bottle? Because I thought
dropper,
you
yeah.
were able to mix it.
Yeah,
You
you
can't
It's
can
in a
just the
take
way-
a bottle, but they recommended not to do like a full thing because you don't
Yeah,
want them to take the
because you're
full-
not sure if the child is, if they're gonna have everything at once. So,
Right.
yeah.
So you can mix it with the formula or breast milk, but
Yes.
you would have to give it to them in a Doppler form.
If they give you the option to put it in like a little dropper or something, choose the dropper one, I
Yeah.
think.
Okay, because that's what I think I messed up on, because I think I don't want to talk about it. But yeah, all right, thank you guys. Talk about it.
And then before everyone had gotten on, me and Hannah were talking about, I don't know if I already said this twice or not, so I'm sorry if I did, but the hyperthyroidism, the Graves' disease falls under that, the toxic multinodular goiter, and then the toxic adenoma. So those are the three that fall under hyperthyroidism. And the treatment for that stuff just depends on the hyperthyroid state.
Okay.
And like the main treatment for Graves' disease is the radioactive iodine.
Yes, ma'am.
It's about the 48-hour
hmm
window and stuff. And then hyperthyroidism, the major complication is the thyroid storm. And we were talking about like it's just hectic and crazy, and hyper is supposed to be fast. So I got those confused before, so now I understand. And then signs of thyroid storm is cardiac dysrhythmias, fever, or neuro impairment. And then we already talked about the pediatric thyroid.
So for the thyroid storm, I thought that there was a question last time on like does stress induce it? Do you remember that question? Because I remember Miss M, I felt like she was not explaining it to me, and I felt like I never really got it. But I mean, I know it comes along with hyperthyroidism, but I thought that there were things that triggered that. Does anybody know? Is it?
Yes.
stress
For
at
the
all?
thyroid storm, I have precipitated by stress,
Okay.
such as injury, infection.
Okay.
Yeah.
Is that the one about like the cause for it?
Yes, for the causes
Okay.
of it.
Yeah, I think the case study, which I think was during the Q&A or whatever, for thyroid, that one, because I went over it and it had the thyroid storm, so that kind of clarified a lot for me. So if you guys have the notes on that, that one was good.
Okay. And then the hypothyroidism is the myxedema coma.
a complication,
Yeah, that's the complication for that one.
or when people don't take the medication.
Yeah, it happens in underdiagnosed hypothyroidism or them missing taking the medication.
So would the hyperthyroidism causes be the Graves' disease and the toxismal tender goiter? Would that stuff be the causes of hyperthyroidism?
I think the cause is more so like them not taking their medication or them not knowing that they had hypothyroidism, and then it
Okay.
just progressing to that. But
Okay.
Yeah, a lot of people, they don't know that they have it. I remember a girl in the previous class, and she didn't know she had it, and now she can get pregnant.
Dang.
Oh no.
Yeah, I think it said in the video too that some people don't know that they have it until it's really bad.
Yeah.
And
Yeah.
so signs of hypothyroidism or myxedema coma is decreased respirations, CO2 retention.
See, I'm getting hypo and hyper mixed up, and I always do that.
I did too, but
So with myxedema coma, everything is hypo. If you can remember that,
Yeah.
everything is
But it's like
hypo.
worse.
And
It's like the extreme for it.
Okay.
Decreased cognition and,
'Cause
and depression. I don't know if you guys said that or not with the myxedema coma.
What was
Myxedema.
that?
Depression and decreased cognition,
Mhm.
decreased respiratory drive. Did you say all of that, Sky? I'm sorry if you did.
No, I didn't get to those ones, so thank you.
Okay, sorry.
And then when Ashley was on, she was talking about to remember different types of hypothyroidism because the mixed edema coma is a complication, but causes would be the Hashimoto's. And she said she remembered Hashimoto by hypothyroidism. So she remembered that's how those went together, which I thought was brilliant. And then
And that was a question on the test.
yes.
What was?
The Hashimoto's
Okay.
for the hypo.
Mhm.
Okay, just the fact that it is hypo.
Yeah.
Can we get another one of those?
Yeah.
I know.
Straightforward. That's what they're gonna do.
So hypo goes with Hashimoto's, right?
Yes.
And mixed
Okay.
edema.
Maybe they'll use one of those select all that apply, and
And-
it'll be like Hashimoto's, mixed edema coma.
I hope
That would be
they
great.
don't.
Be like, yeah,
So-
that's a good idea, the Zoom.
Mhm. So, okay. I'm just making sure I'm right because I think that's what was confusing me on the exam is knowing which one went with which.
Yeah.
I was lost
Mhm.
whenever I saw all the stuff too for the exam. And now I'm looking at it, I'm like, okay, it makes sense that these are all grouped together.
Okay. And then I have
Okay,
a quick question because on my slides, I have a note here and I'm not sure if I've written it in the right spot or not because it's under hypothyroidism and I've written down medications. I have lithium written down.
So those
Y'all
are
know?
the drug-drug interactions.
Okay, so don't use lithium.
So what I have
that what
here
you're
is, because I think that's on chart 52.5, levothyroxine drug-drug interaction is lithium, and I think it also has something to do with magnesium. So,
Okay.
and it also increases bleeding if taken with warfarin.
Warfarin, aspirin, yeah. The
So you have to
magnesium. the
decrease
anti-
warfarin doses.
It said antacids with magnesium
Yeah.
decreases the hormone absorption.
Yeah.
Digitalis, if it's taken with that, it just decreases the digitalis effect on the heart. The risk for bleeding with the anticoagulants. And then be cautious with sedatives too.
Yes.
But I didn't remember the lithium, but I do remember it now that you bring it up.
What
Okay.
did you have with for the magnesium? Because I only have
Andrew,
magnesium.
you're killing me with
I'm trying to keep up with y'all. Just to
It's
clarify,
the-
like everything's in here.
It's the antacids with magnesium because it
Yeah.
decreases the hormone absorption.
Okay.
So like you don't want to take those.
Yeah.
And the medical management is the levothyroxine, and that is the dose is based off of their TSH levels. Or they could do for mixed edema coma, they'll do IV T3 and T4, and then they'll switch to oral T4 once they're stabilized. And then another medical management is glucocorticoids, an example being hydrocortisone.
I think on the test she had a select with levothyroxine.
I
Mhm.
remember that too. I remember something with levothyroxine and something just had hydrocortisone on it too. I don't know if that was this past test,
Yeah.
but I remember seeing
Because what I have is you take it in the morning on empty stomach, 30
a full
minutes
glass of water.
before first meal, full glass of water, and it takes weeks to work. And I think once you start taking it, it's forever. Am I correct?
Mhm.
Yeah. But no, you
I
can
think
go ahead.
with the hydrocortisone, what Sky was saying, it was just on this test. I think it was about the glucose, like having to, like making sure you're watching the glucose levels,
Oh. Mhm.
something like that, which I was just like, okay, great. Yeah, I missed that one. Let me write that down.
Yeah. I just think hydrocortisone like you put on your skin for something.
I was kind of confused because I know in the interventions you have to check the glucose every 4 to 6 hours.
Mhm.
So I was like, you know, when I did the test review, it's like I wasn't even thinking about hydrocortisone, but I know you had to you had to check the glucose. So yeah, I think they're very tricky with their questions.
Yes. The only other thing I have written down is like the comparison chart that she had at the end of the video talking about hypothyroidism and hyperthyroidism, like signs. The hypothyroidism is tiredness and fatigue, constipation, the cold intolerance, they're going to gain weight. They have edema of their eyes, their face, and their hands, and then they'll have decreased growth. And then for hyperthyroidism, they're going to be nervous and anxious. They'll have diarrhea, the heat intolerance, weight loss. And then she had smooth, velvety skin. But I guess that's because the hypothyroidism has dry, thick skin.
I know I had this somewhere.
So just thinking about tomorrow, are we gonna try to go over like the rest, like the mobility, oxygenation, perfusion, like do that kind of stuff tomorrow?
Whatever you
I
guys
don't
want.
like mobility.
Yeah, that would be good. I feel like I did okay on the mobility. I think I got tripped up a little bit.
Which it's
With
there's
the
not a lot to it, so I mean that way we could just run through pretty quickly.
Yeah. I think I just got I
Go
think I just got a little upset is because I asked her specifically in a Q&A because on the osteoarthritis, there was a couple of medications listed in the book. So I remember specifically asking her, which medication do we need to be more familiar with? And she said this one. So I was like, great. We got to the exam. That was not there.
You mean the topical one?
No, that was not on the exam
Yeah.
either. Because I remember you messaging me and you said, well, this was on the exam in spring. And I said, okay, I'll put that in the back of my head, but I'm going to really work on this one. And then it was neither one.
The COX
And I was like, I
inhibitors. I
specifically
remember
asked
she
you,
said.
Miss Marrero, I specifically asked
It's probably
this
because
question.
she took it off the exam.
She-
I'll
That's
show
what
her.
it was. That's what it was. Because I was like, okay, because there was a couple of them for the osteoarthritis. So now I know that if the book lists like 6, you better know just all 6.
Mm-hmm.
Well, if you guys want, because I do have to go after this one, but
Yeah.
if you guys let me know like a good time tomorrow, maybe in the afternoon, because I haven't started any of the other stuff for review yet, and we can go over that stuff too. And then
Okay, awesome.
like the electrolytes a little bit too, if you guys are down.
Yeah.
Okay.
Sky,
Also,
whenever is
Sky,
good
can you-
for you, since you're the one setting it up. So,
Yeah, I like this because it's kind of
listen, whenever is good for you.
When you
Yeah,
read
because
by
if
yourself, it's like, oh,
yeah, because and also if you can find out where these recordings went, Sky, would you be able?
Just somewhere.
They're floating around in outer space.
I
They're there somewhere. They'll show up.
seriously have no idea what I'm doing, but I will
So
try.
that way I can re-access them and go over them for things I missed, because even when you're talking, sometimes you miss little things.
Yeah.
I got
for
you.
sure.
I'll
I
send
got
it
you.
out. If it disappears and you guys are gone, I'm sorry I didn't do it. But thanks for coming on. It was really helpful.
Yes. Yeah, I
Thank
appreciate
you,
you
Sky.
organizing it.
Thank you.
Yes.
yeah.
Thank
It was
you.
very helpful.
Hopefully.
Right, y'all have a good night. We'll see y'all tomorrow.
Yeah.
See you
Bye.
tomorrow,
Thank you.
guys. Thank you.
Thanks.
Thank you again, Sky.
You're welcome. I'm gonna try
It
to
was one